looking at all of the information across the United States, we do see improvement across all the large metros. I know that we've been talking about the New York metro area, New York City, Rhode Island, Connecticut, Long Island, and really we do start to see improvement there, and we see improvement even now in Rhode Island and Connecticut. The Detroit metro is doing quite well with significant declines now. New Orleans is nearly back to their baseline of where they started for new infections. We also are seeing improvements in Chicago and Boston, and that has been a great concern for us over the last several weeks, but they appear now to be flattening. Both also Philadelphia and Houston, Atlanta, Nashville, Baltimore, Indianapolis, and St. Louis also appear to be flattening. The D.C. metro area, we don't see a decline yet, so hopefully all of you are still social distancing and doing everything that you can. I wanted to remind everybody of 2 points. When we brought up and the president put out the guidelines for opening up America again, it was very clear to use data and to really work together to mitigate against any resurgence, and also critically to protect the vulnerable. And what we're seeing across rural America and in some of the smaller population states is we're still seeing outbreaks in long-term care facilities. And we asked everyone in phase 1 to make sure that they continued their social distancing in public, to ensure that the vulnerable with comorbidities and other conditions and among the elderly were staying at home, and making sure we're still providing service to them. But as individual Americans, as we begin to open up, we also made it very clear that individual Americans need to continue all of their hygiene pieces, ensuring social distancing, washing hands, not touching their face, and making sure that they're not bringing the virus home to vulnerable individuals within the household. And remember, those were to continue through all 3 phases. And so really want to call people's attention again to the guidelines. We are continuing to see outbreaks in nursing homes and in confined spaces, and I think as Americans we want to stop that, and we have the ability to do that by really paying attention to the guidelines that were to be in all 3 phases. And so I'm calling on the states again to note that an informed community and knowledgeable community is a protected community. So make sure all of your states have your cases up, visible to the communities, so they can make decisions and understand where the virus is in their community and understand how to tackle it with their state and local governments. This will be absolutely critical. And the surveillance that we called for to find asymptomatics before people get sick as an early warning signal. We asked for those to be in the federal clinics, in our inner city, more vulnerable areas, among indigenous populations, and of course in our long-term care facilities and prisons. We really want to support state and local governments to move forward on these critical monitoring to protect individuals that may be in the most critically vulnerable states. We will continue to see mortality and deaths among our American citizens, particularly in the cities as they begin to move past peak, because deaths will lag. And so we really need to continue to unite and really support our healthcare providers who are still on the front lines. They have been on the front lines now for weeks and weeks and weeks. And so no matter what city they have been in, they have not seen the relief that we've been able to talk about at the light at the end of the tunnel because of the delay in hospitalizations and deaths.